Welcome to Pipeline Health's Paragon Basics for Nursing Printing ED Discharge Instructions. There are two components of an ED discharge instruction. There is the patient education and the discharge instruction. I will teach you how to print out both, which will complete the ED discharge instructions. First, highlight the patient. For this example, we will use PipeNet EHR Trainer. You will highlight the patient on the tracking board and go ahead and click on ClinDoc. This has now pulled up the clinical documentation tab within that patient's chart. To print out instructions for the patient, you can click on I. The I button will take you to the patient education. When you click on the I button, you can click on the patient's name. It will take you to the Get Education module. You can choose on a problem to curate the education list and click Retrieve, or you can simply click Retrieve. This will now launch you into Micromedics Care Notes. If you've chosen a problem, they will curate the education based on the problems chosen. To choose multiple education, you can simply click on multiple education checkboxes and then click on Select Titles. You can see that both of the education documents that I had clicked on are now visible. Choose the appropriate education and language if able. Because these are emergency department instructions, we will choose the ER aftercare instructions. At this time for these instructions, only English is available. There are many times when Spanish is also available. If you wish to preview the education, click on the spyglass hovering over the paper to open up the preview. You can view what the education will look like for the patient. If this is sufficient, go ahead and click on the Close button to go back to the center screen. Now that you're back on the original screen, if this is the education that you wish, you can go ahead and click on Print. You will get an alert. This is still a secure website, so please do not be concerned. Go ahead and click on Send Anyway. This will now load the education. Once this document is loaded, you will notice that there are two signature pages. There is one signature page with information on top, and then a secondary signature page. This first page will need to be signed by the patient. It will then be scanned into the patient's medical record. When you are ready to print this out, go ahead and click on the print icon. The print icon will launch the print window. When you click on print, it will now print to your local printer. When this is done, you will be taken back into your PCH screen. You have now printed out the patient education. You will now need to print out the discharge instructions. To do this, the discharge instructions will need to be added as a note. Go ahead and click on Add Note. If you do not see or have not saved the discharge instructions as a template on the right-hand side, you can type in discharge instructions. You will notice the ED discharge instructions. To pin this to your most frequently used, hover over the three dots and click on Pin to Top of List. You will now see that the template for the ED discharge instructions are saved on the top. You will only need to do this once. After this, the template will be available for any patient that you access. To start the ED discharge instructions, you can either double-click or drag and drop the template to the center of your screen. I also recommend that you change to Preview tab on the upper right-hand side so you can see the information that will be printed. Prior to completing your discharge instruction note, please make sure that the physician has completed the discharge medication reconciliation. In order to see if the patient patient's medication reconciliation has been completed, you can click on the Ordering tab and then click on Medication Reconciliation. If it's been completed, you will see that the discharge medication reconciliation has been completed by the physician. You can now go back to your Documentation tab. You can see that the discharge medication reconciliation has also been completed by clicking on Previews. You will notice that the prescription information and home medications have all been listed on the right-hand side. If the patient's medication reconciliation has not been done, you will see a list of their medications with a checkbox on the right-hand side. This will now require you to have the physician do a manual medication reconciliation, and the entire discharge instruction will then have to be scanned into the medical record before being given to the patient. On the center screen, you can see information for your discharge instructions. The reason for the visit is pulled directly from the patient's registration information. If there is any follow-up appointments, you can add it here. If you do not have follow-up appointments for the patient and you don't fill out this box, you will notice that it does not show up on the right-hand side. As you scroll down, you can see that the prescription section has already been pulled from the discharge medication reconciliation. The allergies have also already been pulled, as well as the home medication instructions. Since you have already done the patient education by going through the I button, this has already been completed. You can also complete the patient education within the discharge instruction note. To access the education module from here, click on the three dots and click on Manage. This will take you to the patient education list. Go ahead and click on Get Education. This now launches you into that original screen when you clicked on I and the patient's name. The steps from here on out are the same. If you click on the problems and click on Retreat, this will launch you into Micromedics. I will X out of the screen as we have already completed this step. You can see as we scroll down this list that there's also some information such as the tests that were ordered on the patient, as well as instructions. These can be any instructions that you wish to give the patient. As you scroll down, you will notice that there are two signature pages, as well as something that says P style. Please do not worry about this language within the preview section. This does not get printed out. It, however, tells the computer to print out two signature pages so that one signature page can be signed and saved in the medical record. Within ClinDoc, we have the ability to give patients a copy of their results. In order to do that, you will click on the Results tab. When you click on the Results tab, you can see that there are some laboratory as well as imaging results. In order to include this information, you can click on the checkbox for each information that you would like to include. When you are ready to include it, click on Include a Note. You will notice that it says Add above or below instructions. In order to be in the correct area to pull in the information, I do recommend that you go on Tests Ordered. When you click on Tests Ordered, it will now highlight the area of the note that you are on. I do recommend that you include any laboratory or radiology imaging results under Tests Ordered. Now, when you hover over Include a Note, it gives you the option to put above or below Tests Ordered. I recommend that you put the results under Tests Ordered. You can see that now the laboratory results have been included into the discharge instructions. In this manner, I will also include the radiology information. I will click on Diagnostic Imaging. I will check the CT head, hover over Include Note, and click Add Below Laboratory Results. The discharge instructions now include laboratory and imaging reads for the patient to go home with. When you are done with your discharge instructions, you can click on Save. When you click on Preview, you will notice that now the discharge instructions have saved on them. From the Preview window, you can click on Print. When you click on Print, this will launch a new print window. This is going to load the discharge instructions. Click over the square next to the X to expand the secondary screen. Once it is expanded, you can see the note in its entirety. You will notice that there are two signature pages. The two signature pages allow for one page to be given to the patient and one to be placed into the medical record. In order to print the document, go ahead and click on Print. This will launch a secondary print window. When you click on Print in the left-hand side, this will now print to your local printer. To go back to the Documentation tab, click on Cancel. You will now notice that the ED discharge instructions say printed. Take both the ED discharge instruction as well as the patient education and hand them to the patient.